Bioterrorism is violence through the methodical release of bacterial organisms, toxins, or viruses. As the manager of a company, it is important to be informed and prepared to deal with the consequences of a bioterrorist attack. The main goals of bioterrorism are to cause sickness and death in victims, in addition to creating panic and fear and disruption of social and economic activity. It has become a popular form of terrorism because agents can be easy and expensive to obtain, it is very tough for people to detect, and it creates mass panic and disruption beyond the damage that concrete agents can produce. Bioterrorism is most commonly used for warfare, but its potential for mass destruction if used by non-state actors in the future has become a rising concern. The CDC has developed a system to prioritize biological agents into 3 categories contingent upon the severity of their effect and how easily they can be spread. Category A includes agents with the highest risk to public health and national security. These agents can be transmitted from person to person. Examples of Category A agents are anthrax, smallpox, and tularemia. Category B includes the second highest priority of agents that result in lower mortality rates, such as salmonella, glanders, and ricin. Lastly, Category C covers agents with the third highest priority and infectious diseases that are developing and can be engineered for mass distribution in the future. These agents are easily produced and spread and include HIV/AIDS, SARS, and Nipah virus. In the event of an act of bioterrorism, individuals, companies, and communities at the local, state, and national level may all be adversely affected. The CDC conducted a study on the impact of various biological warfare agents after release as aerosols in the suburbs of a major city. The study concluded that the economic loss associated with the bioterrorist attack can range from $477.7 million to $26.2 billion per 100,000 individuals exposed. In these scenarios, major costs resulted from the establishment of a post-attack intervention program, premature human death, hospitalization, post-hospitalization outpatient visits, and outpatient visits of non-hospitalized patients. In terms of the more direct impact on a company, the cost associated with loss of productivity can be as high as $50.9 million, $15 million, or $26 billion per 100,000 individuals exposed, resulting from hospitalization, outpatient visits, or premature death, respectively. Similarly, a bioterrorist attack will undoubtedly affect one of 3 major services: mail, transportation, or communication, leading to major difficulties for companies trying to conduct operations. Mail services would most likely be suspended, and materials already in the mail will be on hold indefinitely. Transportation disruptions will cause difficulties for all employees, especially those in roles that involve regular travel to meet with clients. As bioterrorism is an uncommon phenomenon, it is harder to discern vulnerable sectors of the economy. Sectors of key concern for the government include healthcare, agriculture, mail services, and blood supplies due to their direct relation to human health. Mail services are a weak point for bioterrorist attacks because the attacks can be facilitated from a distance. Other industries that could be specifically targeted include chemical manufacturing, food processing, cruise lines, and events with heavy media coverage. These allow terrorists to access a large amount of people, either at a distribution source or due to containment in a small space. Particularly vulnerable industries usually have existing safeguards and can prevent or react quickly to breaches or attacks. Most industries will more likely experience an indirect impact on personnel, revenues, or purchasing costs, along with potential stock price changes. Any company can be a target, either due to their controversial practices or simply to inflict economic damage and fear. More protected industries include IT infrastructure, electronic and non-centralized business, and rural-based non-agricultural industries. These industries exist in less populated areas and often have systems set up to work from home, making them more flexible in the event of an attack. Particularly vulnerable industries to indirect attacks are travel industries, hotels, airlines, insurance companies, trading firms, and those conducting global trade, as they rely on a strong economy and international image of the country. Fear reduces people's spending habits and lowers confidence in the market, which is often the goal of a terrorist attack. Governmental controls to prevent similar attacks in the future can also impose high fees on global trade and travel through restrictions, tariffs, new regulations, and time-consuming procedures, making it more difficult to sustain businesses and often causing drastic rises in costs. In regard to the prevention of and reaction to a bioterrorist attack on a business, a firm must first establish and manage a prevention program catered to a bioterrorism attack using any of the three categories of agents. Next, a business must plan and research in order to gauge the risk associated with a particular business, taking into account industry risk and volatility, the size of the business, their market share, and the firm's significance to the general public. In order to be best prepared, firms should research and understand the preparation of a bioterrorist, including type of perpetrator, types of biological agents, and their mode of delivery, whether it's via water, food, air, and/or fomites. Planning and research will prepare a firm to construct an implementation plan addressing resource management, emergency response, crisis communications, business continuity, and employee assistance within the firm. In order to evaluate the faults and strengths of the plan, a business must test, train, and exercise this implementation plan. In an effort to maximize the utility and availability of resources, a firm should partner and network with other private and public sector firms as well as public health systems to ensure sufficient capital and resources to prepare and respond to attacks. Although a business may go to many lengths to prevent an attack, they should also engage in an insurance plan in which part of the premium may be negotiated for reinvestment towards surveillance systems, ensuring sufficient supply of vaccine or remedies on site or readily available through an alliance network, conducting research to improve detection, and improving implementation plans.